Hi everyone, it's Saturday the 29th of June, so it's now officially into the fourth day post-surgery, and I think I'm recovering pretty well actually. I'm not quite so bent over like this anymore when I'm walking. I'm kind of sitting fairly upright now, as you can kind of see. I'm sort of sitting upright. I feel pretty good, apart from a bit spaced out from pain medication, which is to be expected. So all in all, you know, I'm doing pretty well. So I thought I'd just jump on and kind of talk to you a little bit about, you know, what sort of processes were going on in the last couple of days after the DCIS, in case anyone else is having that sort of procedure. And I'd also be really interested to know, if you've had a DCIS, you know, whether your experience was similar, because I imagine for different people they do slightly different things and maybe have different drains or different types of wound management systems and things. As you can see, I'm sitting up in bed now, obviously not wearing any kind of bra or anything. So I've got my two new boobs here, which feel lovely and warm and soft and natural, rather than the cold implant that I had before on the right side. I've got an abdominal binder on here, which is kind of like a really tight thing that they wrap around with Velcro, and that just helps to control swelling and keep the wound together, and just helps generally with comfort and things like that. Gives me a bit of support. So wearing that all the time, it's such a relief to take it off though occasionally. It just makes me really appreciate what all of our ancestors went through when they were running around in corsets. It's really quite uncomfortable. So when I came out of the surgery initially, they had several drains into the wound. So a drain is like tubing, which is kind of, it's a bit hard for me to show you, tubing like this, which comes, it's implanted in under the tissue so that the fluids can all drain away. And I'm carrying mine around in this beautiful little bag that I got from Bosom Buddies as a gift. Initially I had one drain in each breast, and I've got this kind of other one that's going into a sort of thing down here in the abdomen, which I'll see if I can show it to you a little bit. So this is like a suction system going on down there, which is a big waterproof dressing with a vacuum system. Sorry about that interruption. I tell you what, in hospital, one thing that's guaranteed is any time, day or night, when you actually just want some peace and quiet, you're going to have visitors. And this hospital is no exception from any others. It's either the cleaners coming in, or someone's changing the bin, or delivering lunch, taking the lunch tray away, somebody's changing your dressing, somebody's checking your obs. So you're kind of getting visitors several times an hour for sure. But they're all doing an amazing job, and one of the really sweet things was at the last couple of days, there's been people coming in who are volunteers, wondering if I would like a little handmade crocheted blanket that somebody had made and donated, craft supplies. They do special kind of craft therapy here, so the volunteers are wonderful as well. Always all these people who are so willing to do really lovely things for other people, because of course this is a cancer hospital, so there's lots of people here who are really suffering. But thankfully at the moment I don't really count myself as one of those. So anyway, where was I? I had, after surgery, I had one drain in each breast, which was like on a little vacuum suction thing that was drawing any excess fluid into a special thing, like a bag that they can measure the amount of output out of the drain. And when the output of all the seepage from the wound really slows down, that's an indicator to them that they can take the drain out. So over the last couple of days, I've had both drains out. One decided to take itself out actually, and so I kind of ended up with stuff everywhere all over my pajamas, but luckily I had some spares. And today they took the other one out. So the one that's left is this one that's managing the big abdominal wound. And it's kind of weird, every time they come in and they check the dressings and everything, and they recheck the little vacuum unit, which is it's kind of this thing here, looks like kind of a camera case or something like that, and it makes farty noises all night long. It's kind of causing a big suction in the abdomen, keeping everything sort of tightened together and draining excess fluid away. So it's kind of, after they've checked it, I can almost feel everything kind of going sucking back down, which is a very weird feeling, but it's clearly doing the job because there's lots of fluid draining out of it. So I think I'll be going home with the lovely farting machine here. When it goes off, I'll see if I can show you what it sounds like. I think I'll be stuck with that one for probably another week yet, but the other drains are out, so I'm able to move around a little bit more freely. So I've got this stuff kind of like Glad wrap, I suppose, from just underneath the boobs to just above the pubic bone, which is sort of sealing in all of the abdominal wounds down here. So yeah, that's kind of the way it shaped up for me. I'm not sure if everybody's DIEP would be identical, or the way that all the surgeons do them would be identical, but yeah, that's what my situation was like anyway. So that's all I've got to really tell you at this point. I'm recovering very fast, and I'm hoping that by Monday, so that'll be like day 6 post-surgery, they'll be discharging me and I'll be able to go home. But the most important things is that all of these dressings and everything have to stay dry for the next couple of weeks, particularly while I've got this vacuum wound management system on the abdomen going, so that it all doesn't break down if it gets wet in the shower or something. So, you know, a little bit of fiddling around to go, but, you know, I've made it through the worst of the post-operative time. So I'm just very grateful to be able to sit upright comfortably again now and move around fairly freely. Okay, I'll keep you all posted. Cheers.